Access to medical care is becoming more and more of an issue here in Guam, and it doesn't even matter if you have the ability to pay. It's getting harder to see a doctor, to get an appointment, or to get the specialty care that you need. So I want to show you a growing solution to a growing problem. They're going to go out of their way to help find you a solution. And they've been growing their clinical services. Aside from this place looking and feeling homely, like this is their waiting area. Like, I don't think that people really understand that they do full clinical services here. Like, this is one of their clinical rooms. Look how nice it is. You get your vision exam here. So do you need to see an OBGYN, get family medicine done, internal medicine done? This is all stuff that's done here at the Total Guam Foundation. And just to tell you again, this place is not for profit. This is the psychologist's office. Yes, they have a psychology department. They also do psychiatry. It's an entire mental health department that they have here on top of all the other clinical services that they provide. If you need medical care, if you're having problems getting a doctor, getting an appointment, call the Todu Guam Foundation at 649-TODU or 649-8638. You can visit them on the first floor of the Sunny Plaza building that's next to Sunny Outlet and behind the old Bank of Hawaii building. I am so sorry for how late I am this morning. There's no real, I don't have any reason. I was just, my morning gossiping, my morning scrolling through Facebook and Instagram because I'm business tao and, one next post, one comedian's act after another, or and all of a sudden it's 8:05 a.m. and I'm flipping out. And I'm very sorry that I'm late. My name is Troy Torres. It is now 8:09 a.m. on a show that's supposed to start at 8 o'clock on Monday, May 18, 2026. Happy birthday to Tina Sablan, our dear sister from Saipan. There are three things that I want to talk about today. One is the Pleadwell-Hermoda gubernatorial campaign that never made it to first base. I want to talk about how their campaign has affected the primary election and who the present circumstances might benefit from them having made a push and also the Guam Election Commission having not qualified them to be on the primary election ballot. I want to talk about the governor's hospital dream and how more and more it's looking like it's going to not happen, and how more and more it's looking like we are going to lose somewhere north of $100 million in federal funds. I have never, ever since I've been watching the news from the Gutierrez administration forward, I have never known the legislature to be so okay with federal funds being lost. I remember when at the end of the Camacho administration going into the Calvo administration, then GDOE Superintendent Narissa Underwood surprising everybody with, hey, we're going to lose ARA funds. And I think it was like 60 million or maybe 40 million or something. It's a big amount of money. And I remember everyone being up in arms, from the governor, the former governor, to the current governor, back then, right? The senators, especially oversight hearings galore. I mean, giving back of federal funds was just, it was something that you shamed, something that you looked down on, because you didn't want that cycle to repeat. But here we are in this 8th year of this administration, and it almost seems like it's okay with everybody. I mean, yes, there are senators who are making some type of deal about it, right? But it's just not like before. It really isn't. I mean, the standard for accountability and transparency has dropped so far down that this is really going to take some reform. And it's kind of weird because it's like reform on basic stuff, a reform in culture, in the culture of leadership in the government of Guam. Before it was the culture of leadership, the standard was always really high, right? That the voters had. I mean, not high, but like pretty up there, And it was an issue of the culture of government of Guam service. Now we can't focus on the culture of government of Guam service and output because we have to busy ourselves as voters worrying about the culture of leadership in the government of Guam. And it's just such a sad thing to behold. Anyway, so there's that. And then I don't know if you all saw the news coming out of the World Health Organization, the New York Times, all these national and international, Al Jazeera, like just the BBC, everywhere across the globe. For the first time in my memory since like the 1990s, there is a concern that Ebola is going to come out of Africa and jump on a plane and go somewhere else. And so we're going to talk to Dr. Hoa Nguyen about those risks. I had a brief conversation with him this morning. He said generally it's a low risk, but he didn't tell me it's a no risk. And Ebola flips me out ever since I've been reading the newspaper in the I've been reading the newspaper since the 1980s, but I only remember Ebola being something in the news in the 1990s. And I know it's been around longer than that, but I remember it in the news in the 1990s, and I remember reading about it and flipping out like, I don't want Ebola. I don't even really know what Ebola is. I can't even tell you if it's a virus or a bacteria or is there something else, a fungus? I don't know. But all I know is that it causes lots of death, and it's painful death, at least according to reading the newspapers back from the 1990s. And so the news over the weekend, coming out of the national and international wires about an elevation of public health risk regarding Ebola, as in globally. And I was like, whoa. Are we, as soon as I see that tourism commercial from Lou and Josh about everyone from Africa, come over to Guam, we got a great vacation spot going on here, I'm going to flip out. You guys remember that. You guys remember COVID-19, right? Anyway, we'll talk about these three things on the other side of the commercial break. Stick with us. And I start with 76.
Good Morning Show with Troy Torres is brought to you by 76 Circle K Guam.
Welcome back. Good morning, everyone. My name is Troy Torres. It is now 8:15 a.m. on Monday, May 18, 2026. Good morning to you all, and I appreciate all of you for your live viewership and also those of you who will watch the replay. This is the morning show called the Monday News Analysis. God bless you all. Let's talk about the first subject, and it is the governor's hospital dream. So, I mean, a brief recap, right? This is a pretty big subject, and it has been a pretty big subject for the past, I think it's 4 years now. 4 years? Was it 2023? 3 years, for the past 3 years now. Or was it 2022? Anyway, it's been some time. Governor Lulian Guerrero, when she first ran, she said she wanted to build a new hospital. Okay? This is one of those election promises where even though she will go through these 8 years without having built a new hospital. And it's questionable now whether there will even be a legit groundbreaking. I don't think we can. This is one of those things where we can be like, oh, it was a broken promise. Because Governor Lulian Guerrero really tried to build a new hospital. Just like Governor Eddie Calvo really tried to build a new hospital. They both failed, right? I mean, I think I think that by the end of Governor Leon Guerrero's term, because it ends just, 7 months from now, I just don't see a groundbreaking happening for a new hospital, right? So I think it's almost safe to say that this dream of hers is going to fail. Barring, extraordinary circumstances, let's say the district court rules in her favor. I think it's a different judge now that's been assigned. Let's say this month that judge is caught up in all of the questions on the case and is able to make a ruling and says, yeah, I agree with Judge Bordallo. I'm going to dismiss the Attorney General's case. I'll tell you what's going to happen. The AG is going to sue in the Superior Court of Guam. And it's going to be so there's all these cases, right? It's not going to, the litigation on this thing, I really don't think is going to be done this year. And I don't think that the governor is going to be able to get an inch in here. Right or wrong? Right. I'm not saying that the AG's right or that the governor's right or whatever. I'm just saying I don't think it's going to happen. But let's just say that the AG doesn't decide to launch a suit in the Superior Court after this judge, let's say the judge dismisses it, right? Let's say everything goes in the governor's favor. And let's say she's got this green light in the month of June, because June's just 12 days away, 13 days away. Let's say she's got a green light on June 1. She's got this $100-some million that is obligated strictly for a new medical campus, strictly on that Fidian site, because it's already obligated. I think this is what some of the politicians, they try to gaslight us, when they say like, oh, the governor can just reprogram that money. She can't reprogram the money. So it's use it or lose it at this point. So let's say she gets the green light, GPA and GWA start the procurement, or maybe, perhaps, before they start the procurement, I would hope that if this is what the case is going to be, that it's done the right way this time, that before procurement starts, the governor sends a bill to the legislature and she's like, hey, these are extraordinary circumstances. We cannot lose this $100 million. Can you give us this pass, this hall pass, so that GPA and GWA can forsake this part of the procurement process and this part of the procurement process and change this part of what the law says about liquidation, so that we can get this $100 million, or at least a large portion of it, spent, liquidated by December 31 this year for the Fidian site, for the water, wastewater, and power infrastructure. I'm not saying that's a good idea. And I think that actually what I want to say right now, actually, considering the audit that has come out about the governor's use of federal funds, the government of Guam's use of federal funds, I think that there needs to be a higher level of scrutiny, because we have now seen in black and white what an independent auditor has said about the government of Guam's use of federal funds during this administration. So there's that, right? Let's say that the legislature is able to get that bill done, and because you would want a public hearing for that, I would think that the Speaker of the legislature would not waive a public hearing for something like that, right? Let's say they get that passed in late June. So the governor is able by July 1 to go out using the procurement system, using the tailored procurement system for this, to get the whatever contracts need to be done for water, wastewater, and power infrastructure, as much of it as they can get. How much construction can actually be done between July 1 and December 31 on this Fidian site? How many of those task orders can go from 0 to 100% complete, so that liquidation, as in the payments, can happen and the money can be rolled out? I just don't see it happening in any sort of big way. Maybe some of the money can be spent, but certainly not $100 million. I don't think, even if you tailored the procurement process, even if you circumvented the procurement process to make it much easier to spend that money, I just don't see $100 million being spent within the next 7 months. And so I think we're going to have to start in our expectations, understanding that we're going to lose a lot of this, if not all of this $100 million. We're going to go through another 8 years of another governor's hospital dream going down the drain. And then we're going to have to rely on the vision and the ability of the next governor to work together with the legislature and whoever's the attorney general to get a hospital done. And where and what are the timelines and all this stuff. And if you ask me, right, setting aside the audit stuff, setting aside the location issue, setting aside how the governor went about the location issue, I think it's a very sad thing that this vision has not been executed. And I really do give credit to Governor Luliangaro for trying. Now, she might not have approached things in the most leaderly and orderly of ways. But she really did try. And she really did have such a great vision of this medical campus and what it would mean to the long-term economic development of the island, not to mention how it could have brought medical care that many of our people need now, and all of us are going to need as we get older. And it's just such a sad thing. And Governor Eddie Calvo had a vision too. And his vision was not allowed to take foot. And it's all these politics, right? It's just such a sad thing. But I think that as we approach this liquidation deadline and face the reality that we might not be able to save this money, I think we need to be angry as voters. I think senators need to start getting a bit more angry about this $100 million and share in some of that blame for how this $100 million is going to be lost. I think the Attorney General needs to share in some of this blame for the $100 million that will be lost. I think all of them need to be honest with us about this $100 million and the fact that it will be lost, and stop telling us that, oh, we can reprogram the money for this or for that. I mean, I'd like, where's the beef? Is anyone even writing letters to wherever to see? Because it's just not going to happen. Like, I don't even think the congressman has introduced a bill to save that money. Like, it's just not, it's not in the cards. Unless, I don't know. I think it literally takes an act of Congress to change something like that. So we're going to lose that money, probably. We're not going to have a new hospital. GMH right now is going through some repairs. Sure, okay. Definitely, the Guam legislature has not dedicated the funding that GMH needs in order to, and GMH has also not demonstrated effectively through great communication, right, what its needs are and how it is abiding by whatever. And I think there are still concerns about politics being played by the administration with GMH. And so, I mean, who loses in all of this, right? I mean, it's us. This is more than this being the governor's dead hospital dream. Our medical care is not going to improve by this vision because of all the politics and all these years wasted, all that money from the pandemic up in flames, and we do not have a better medical system for it, to show for it. On the other side of the commercial break, we'll get Dr. Hoa Nguyen to talk to us about a medical issue that that is evolving globally, that I'm scared of coming to Guam because I've always been terrified of the Ebola virus. I've been reading about it since the 1990s in the PDN, in the national and the international section of the news. And the description of what Ebola does and how quickly it could spread flips me out. And so news coming over the weekend out of the international wires that there is a global risk of Ebola spread. I mean, that has flipped me out thoroughly. I messaged Dr. Hoa Nguyen this morning. I was like, hey, what's going on with this Ebola thing? And he was like, it's a low risk for Guam, but it's still a risk that it could come here. We'll talk to him about that on the other side of this commercial break. Stick with us. All right, we are getting Dr. Nguyen on the line to talk to us. Hi. Hi.
Thanks, Dr. Nguyen. Thanks, man.
Hi, Dr. Nguyen. You're on live with our audience here on Candid. Good morning.
Oh, good morning, Roy.
Good morning. Thank you so much for taking our call. I know you're really busy, so we'll try to make this as fast as possible.
Okay.
What's going on with this Ebola thing?
We it's had an outbreak, but really it's in the Congo area. It's not anywhere else beside that area. So it's really we are very low risk as Guam is as much as people travel in and out, but it's very we are in a very low risk area, so you don't have to worry. But just if you go to the Congo, yes, you're going to be at risk for it. But so the virus is not airborne, right? So it's just like it's not like COVID that is airborne and you can catch very easy. It's strictly it's direct contact,
Like
through
like
blood.
touching a person? Like
Yeah, but only person is symptomatic. Okay, so you can have the Ebola virus in you and you don't have no symptom at all. You are not contagious. They only contagious when they become symptomatic. And the part is that if you're symptomatic already, and if you survive, you can be contagious up to 7 weeks after that. But if you catch the Ebola virus and you have absolutely no symptom at all, you're not contagious to anyone.
um why is the World Health Organization saying that there is a risk for a global spread?
I don't know. Mostly right now, Ebola have been there for years and years and years, right? It's really in the Congo area, but the worldwide spread because people travel. Like they can go to the Congo, they travel, they can take the virus off, somewhere to the country. If they, every time you go to those area, when you get back to your country, there's a lot of questionnaire that you have to declare, right? So people are watching you when you travel to those area. So there's always a possibility, but it's not like COVID that we have to worry about.
Is there a treatment or a cure for Ebola?
Uh, there's a there's a um monoclonal antibody that you can get treatment for it. Just like with the COVID, I don't think that is widely available. But the treatment for Ebola is really symptomatic. Of most people, have diarrhea, vomiting, and dehydration, and those stuff. That's what you treat for. You treat the symptom and hopefully survive. It's a pretty deadly virus. It's much more than COVID. It's like 90% or so mortality rate. If you catch it, you become symptomatic. So 9 out of 10 people will die if
Jeez.
you have symptoms. So yeah, it's a very very dangerous virus. But again, it's only direct contact means through blood, through urine, through saliva. You know, if someone have symptom, they bed sheet, they have urine on their saliva. Yeah, those things are contagious. If something that they touch.
How about sweat?
So sweat, including sweat. Yeah, any body fluid is contagious.
So, okay, what does the Ebola virus do to the body?
Oh, it's just the typical symptom. It's just very severe and very hard to treat. Like I say, fever, weakness, vomiting, diarrhea, rashes, and all those things. Just like a typical virus, it's just not go away. It just destroy the immune system.
I remember as a kid reading that like people would bleed from their orifices. Is that right?
It's affect everywhere. Yeah, I mean that's the part where, like I say, there's no really any symptoms, but there's a vaccine though. But vaccine not really giving to everyone. Is giving to the first line. I'm not sure. Is that because the cost or whatever? But if you have a first line responder or the healthcare personnel that go to the outbreak area, those guys get vaccinated.
Do we have that vaccine on Guam, or if not, would CDC send a stockpile for our first responders?
No, no, we don't have the vaccine in Guam. There's a few vaccine that we rarely see in Guam, and if we need to be, you'll be found at the Navy because Navy deploy people everywhere.
Okay.
But I don't think that we have the vaccine in Guam, and I don't think that the CDC will send a vaccine to Guam because we are not a first line responder, and I don't think the CDC consider Guam a very high risk area. We're really at the low key area.
Yeah, but what if the governor and the lieutenant governor make a tourism video inviting people from Africa to come to in the
Oh
mid
boy,
in the middle of a global outbreak?
I don't think the governor would do that. I hope she didn't
I
think
mean, they
about
did
it.
it
Yeah,
before, Doc.
uh-huh.
They did it
Yeah, yeah.
before.
But really, we are very low risk. I think it's interesting to read about it, but I don't think that Congo is a destination or choice by many people.
Got
So
it.
I don't think we had to worry about it. I have no desire to go there, so it's okay.
Doc, is it? Can I just shifting gears on the medical side? Is it
Yes.
uh is it that season for people to get their flu shot and also a shinglex the shingles shot?
The flu shot, right now we are in May, right? So a little bit too late. The new flu shot usually come in at early September or so. So I would recommend that people come in early September to get the flu shot. Right now it's a little bit too late because you get another one in September. It doesn't make any sense. With the shingles, you have comorbidity like diabetes and high blood pressure and heart disease. 15 over, I would get the shingles. It's a Shingrix system prevent you from have shingle, right? And most of people have chickenpox when they are a kid, they're children, and the chickenpox virus really never go away. It go to sleep in your spinal cord. So whenever you stress or your immune system is down, it will exacerbate by this rash on only on one side of the body.
Yeah.
Okay, one side, not on both sides, and it tend to be itchy and really painful for it. So
Extremely painful. The most
yeah,
painful thing you'll ever
yes.
encounter.
And the bad part about the longer you wait to get treatment for it, once the rash come out, there's a possibility that you have persistent pain after the rash go away that last for weeks and months. So no, I would recommend that people going at the Shingrix it's not really harmful to anyone, but if you have the symptom, it becomes much less. Getting Shingrix doesn't mean that you won't have shingle, okay? But at least when you have symptoms will be much less for you.
You have to get the prescription for the shinglex shot from your doctor. Would that be correct?
I think you can get that over at Superdrug, Megadrug. The
Oh,
pharmacist
you can just get it
can give
anywhere?
it to you. Yeah, just walk in there and
Oh,
I said I want Shingrix and they give it to you. You don't need to go to your physician, but if you want to, most clinics have Shingrix, so you can walk and request. You don't need to see a doctor like AMC. You can walk in and say I need Shingrix, and the
okay.
nursing staff will give it to you. You
Is it
don't
just
need to
like a
see a
regular
doctor.
shot? It doesn't really hurt?
On the shot, I hate needles, so on the shot will hurt when you give the shot, but it
Really? I
doesn't.
mean, the
Yeah.
shot, the needle's so small,
I know. Yeah, yeah. I
right?
mean, I don't like needle, but
Oh, okay.
most people will be fine to get the Shingrix. So I would recommend them to have them. It's
Okay.
really, I see, like you say, there's a type of pain that even you take Percocet, it doesn't help at all. It's acting a different way in the pain fiber. So it's really very painful when I see
Oh,
people have
shingles
them.
is the most painful thing I've ever had, and I
Yeah,
have
yeah,
slipped a disc in my back, and it's more
yeah.
painful than that. I don't even know how to describe.
Mhm.
It's just an excruciating pain, and it's
Yeah,
constant.
but you have already done, so you can go in and get the Shingrix still. It will really cut down the risk and the severity of the lesion. If you're gonna come back, once it come back and go away, doesn't mean that you cure it.
Yeah,
It will exacerbate at another time in the future. No, if you stress or the immune system is down. So
yeah.
I will get the Shingrix.
Yeah. Okay. Thank you. I'm gonna go and do that. I do want to talk to you, Doc, about one more thing, and that is, I
Mhm.
know you're running for senator,
Yes.
and you have, pretty good chance because everybody knows you have you're a household name, right? And so that's always like the number one thing about getting elected senator is if you're a household name, you probably have a good chance. So let's pretend that you make it in next year to the legislature. We have this situation now, and I was talking about this right before we got you on the phone, where it's looking like the governor's dream of building a hospital is just not going to happen um, while she's the governor. And so, the next governor comes in, the next legislature comes in. What, doc, are we going to do about, first of all, the existing facility? and secondly, some type of vision built somewhere for a new hospital.
Troy, the current hospital at this point need to be revived and somehow make it safe for the people until we have a chance to work for the new hospital. So I think the GMH really need to be fix up at this point because I don't think the new hospital will be happening in the next 2 to 3 years because there's a lot of planning that need to involve the community in it. And the new hospital, it really doesn't matter where location is. I really that location. It's been beat up so much, and we staked our point already. But the new hospital need to be within the means of the people of Guam, right? You have to build a hospital that kind of is it serves Guam in the capacity that we can afford it, right? We cannot build a medical complex, a dream hospital that will be our reach and put our children in a lot of debt in the future, right? So we would just like if you want to build a 300-400 bed hospital, the first thing I would say is that do we have enough manpower to read 300-400 bed hospital? I don't think we can. The nursing staff short, the physician short, and everything we build 300, 400 bed hospital is going to be half will be empty, and we will not be able to upkeep those rooms. So I would build a hospital that is sizable to Guam, and just some things that were necessary and not build a dream. And that's the thing is serve the people of Guam very well without put us all of us in debt. Okay, that's the key.
Have you spoken with any of the gubernatorial candidates about what their vision might be for a new hospital?
Some insincerely, I have not talked to any gubernatorial candidate and asking about just strictly the new hospital. I talked to Frank Glass about the healthcare platform, and I think that somewhat Frank and May are on board regarding the healthcare platform. Troy, is really to access to care. We can talk to a new hospital, but the hospital is something that you and I at the last place that we want to be, right? Well, I don't want to go to hospital. I'm really sick already. But the access to care mean that common people, everyone, rich or poor, can have can get the medical appointment with a provider to do chronic care management to prevent them to go to hospital. I think that's a part where no doesn't matter who the governor is. They need to listen to the healthcare community and say, hey, um, try to build more clinics around Guam that provide access to care so people can live longer and healthier rather than build the last standpoint, the hospital where no one wants to go to. So, that's the key. If you want to keep Guam healthy, build more clinic everywhere so people can go in and get seen by someone. Just like right now, Troy, if you call the clinic, unless people know you, you probably wait 3 to 4 months to get in to see someone. You end up in the emergency room afterwards.
Yeah, yeah, that's a sad thing. And there's also a shortage in well, we have a shortage of social workers, nurses. We have a shortage of OBGYNs, right? A critical
A
shortage of
lot, a lot.
OBGYNs.
If I were right now, I tell you, doctors no good without nursing staff. I'm telling you that. I always say for medical school and everything, I say, all the physicians, please respect your nurse and please treat your nursing staff really nice. And I would get UOG, GCC, give them more fun, make the class bigger for the nursing staff, and try to get them, the, the professor, the staff that you can have a bigger class so you have more nursing one, right? So that's where you can go to GMH a certain day and there's empty bed everywhere because there's no nursing staff to run it. Physician, very easy. I mean, we can recruit physician if we do the right thing. But if we don't have nursing staff, you are done. Physician cannot do a thing. Physician, we spend about 5 minutes with the nurse with our patient. The nursing staff spend the whole day with our patient. So, yeah, get the manpower first before we start planning for a bigger and modern and bigger size hospital. It doesn't make sense if you don't have the staff.
I want to make a shout out to you and Dr. Akimoto, who are my doctors, along with Fran Nickdow
Yes.
over at
She
AMC.
she really grow a long way. That's the part where I highly encourage all the provider to respect your clinical staff. Nick Dow started as an MA, right, medical assistant, many years ago. We groomed her, and she goes through the nursing school. Now she's a PhD, she's a doctorate in nurse practitioner. So that's the key. We grow them and we keep them in warm. So spend the money on your nursing staff.
Right on, Doc. And to be clear, if you were elected senator, is that one of your initiatives in the budget for the next year? Is an increased budget for GCC and UOG specifically for nursing and social work services or social work graduates?
Tony, it really depends a lot. If I were to get in, if I get in, if the people support it, you have to have two things, right? You have to be, right now, I really don't care. I'm a Republican, Democrat. It doesn't matter to me. To me, you should serve the people the same and not the party line. But the only thing I
Thank you.
tell people is that, if you come in the Republican and Democrats majority, I'm done. I can't move a thing, right? Because the only way that I can move things, I'm a chair of healthcare, but if the Democrat took over and people follow the party line, I'm wasting my time because I can't change a thing if I'm not the chair of the healthcare. And that's a part where the politics get a little bit dirty, and I'm as a physician, me, I say things straight, right? I don't if it's not for the people, um, then I will tell you, I'm not supporting it. But so that's my politics where I'm not sure I'm ready to vote for the party line in order to get my bill to go through. And that's a reality, right? I think doesn't matter what party line you are, red or blue, you should serve the people. That's the main thing.
Thank you so much for your time today, Doc. Are you going out there and you asking people? Are you saying specifically, please vote for me, or I'm asking for your vote? You
You
have to
know,
say
um,
that, right?
yeah,
You have to
I,
ask people
I
that.
know, Troy. Recently I just have an accident, an
Oh,
unfortunate accident. And, I just have not just surgery, it's a major surgery on my right shoulder.
oh,
And right now I'm really handicapped.
oh. Okay.
So,
I hope you're okay.
yeah, I'm okay. It's going to take until September for me to recover.
Oh, goodness.
So, yeah, my right hand is tied to my hip, so I can't do a thing at this point. So, I'm just trying to work with my staff to see what's going on and what I can do. But I'm kind of limited even my driving. I really, so yeah, things going to happen. More likely be closer to election time, but yeah, I'm kind of um, trying to figure out what next I have to do because I really can't move that much.
Well, I'm gonna pray for your recovery.
Thank you, Troy.
Yeah.
Thank you. But if people want, really, we need to come out and vote. Every vote counts. So I ask people to, not even vote for me, vote for everyone. But please, do the research and make sure that people you vote in the correct people. But we do need to change a lot of things in one. Even the healthcare, the education, and the safety, the road, everything else. We really need to make a lot of improvement.
Yeah. No kidding. I could not agree more. Thank you so much for your
Yeah.
time, Dr. Wen.
You're welcome, Troy. Have a good day,
You
everyone.
too.
Okay. Bye
God
bye.
bless you. Bye. That's Dr. Hoa Nguyen. He is well, first, oh shoot, my stupid camera. For the camera's gonna go back on. So first, he's my doctor, along with Dr. Akimoto and Fan Nickdow over at AMC. Second, he was talking to us about it. He's very familiar with the medical side of public health. And sorry, I just got a funny note on WhatsApp. And sorry, Jacob Nakamura just sent me a funny note. And I can't say what it is. And third, he's running for senator. He on the Republican ballot, and so the election is on August 1st. He has an injury, so I don't think he's able to campaign as much as he probably should. But I mean, he's got a household name, so there you have it. On the other side of the commercial break, we'll talk about campaigns. We're going to talk about the Pleadwell-Hermoda campaign and how it has likely changed the dynamic of the primary election, even though they won't be on the primary election ballot. We'll talk about them on the other side.
You asked, we delivered. Guam Autospot is extending our overstock sell-off with the hottest deals on island, like our 2025 GMC Canyon with $4,000 off. Or slide into a brand new Mitsubishi Eclipse Cross, starting at just $24,995. September is your chance to drive big and save even bigger. Visit us today or get pre-approved online at guamautospot.com or call 478-AUTO. Guam Autospot, where the savings never stop.
I started off this show by talking briefly about how it's sad that in elections past, right? And we always seem to be stuck on the basics. Every now and then we get something that is visionary, something that is great, right? But it's not, it's the exception rather than the rule in Guam leadership and in the government of Guam. But mostly our focus on the basics has been on revolutionizing, reforming, changing, making better the basics of government, the culture of the government of Guam. And rarely have we been at such a low point in our politics in this island that we are unable to focus on those basics, because now we have to focus on the basics of leadership. There's always been this expectation since I've been involved in politics in 1994 that the leadership that we're going to have, there's standards that the voters, that the public, that the media keeps the leaders to. And it's not like anything grand or anything, right? And honesty isn't even one of them. Like, I don't think. I think I think, you know, let's be real here. There's a general consensus that we all believe that our leaders lie to us from time to time, if not like a lot, right? But we chalk it up to that's just politics. But there is an expectation that our governors, that our senators will face the media. There is an expectation that our governor and our senators talk to each other to get things done. There is an expectation that our governor and our senators come to work, and our lieutenant governors too. They come to work. And there is this expectation that we have certain expectations. And unfortunately, I think that has broken down, that these expectations have become lowered to the point where we're no longer like, here's the baseline, right? This is the baseline, and the baseline was the basics of government service and how it needs to be better. We need to improve that. I think the baseline has gone down. That these are the basics of leadership, and we need to improve that. And because of that desire for cultural change in leadership, not just in basic government services, now we have to work our way back up there, which is so sad, right? In the dream for a better society, right? Like, up here is the high level stuff. Up here is where the public discussion turns to the arts and the humanities, to faith, to truth and reason, right? We are nowhere near that. Like, it's right below that. Right below that is like, systems that work for people and the elevation of people out of poverty and into a great economy. And I mean, we've been here, like we were there in the Calvo administration, and boy, did things reverse real quick throughout this administration. I mean, in 8 years, everything that was built up by the Calvo administration, like we were here. This is where we were. Yes, there were mistakes that were made. Yes, there were problems, but man, we were at this point where people were being lifted out of poverty and we had the greatest economy. Like Eddie Calvo handed over the best economy Guam has ever had to Lulian Guerrero. And then she took things not just to the basic level that we are used to in the government of Guam, but even below that. And I think that's why that there's a yearning for a change in the culture of leadership itself. And I believe that there were a bunch of people who were placing their bets on Jeff Pleadwell and Charlie Hermosa to be those change agents. And I think that a great number of people who would have voted for Pleadwell and Hermosa don't normally vote, or they're not, you would think of them as Republicans, right? But I think them running as independents wasn't just a symbolic thing. I think it was truly a signal of the hodgepodge of people who liked them. They're not necessarily just Republicans. I think these are people who they are truly independent and they'll vote for a Democrat or a Republican, but you just got to be an honest person. And I think that's the key here in these Pleadwell-Hermosa votes. And I don't think it was something insignificant either. I think that there was an opportunity, depending on how much money that they were willing to take out of their own pockets to spend on a campaign, to do the commercials, to have a message out there, because they had a great message, right? We're different. That was their message. That was the key to the whole thing, right? Is we're not these guys. We're not the corrupt. We're not part of this party system. We're not even part of this culture, this government of Guam culture. We are going to be leaders who will change leadership. It's a great message. I mean, Jeff Pleadwell would have had to shave that beard because that beard would not have worked. Like, just like I think Dwayne St. Nicholas needs to shave that beard. It's just not going to work running for, but that's a whole other subject, right? Anyway, so they got people excited to vote in the August 1 election. So much so that they got hundreds of signatures onto petitions. And I'm pretty sure they got people to register to vote as well. And they got people talking about the possibility of change. Now, if I were Jeffrey Pleadwell, and Charlie Hermosa, I would be very upset at the person in my campaign who, without getting clearance, without having something reviewed, went out and gathered how many petitions, how many signatures with the wrong name on the petition. Say what you want about that. Some people are saying, oh, it's just a technicality that should be overlooked. No. It's something basic that should have been. This is the big leagues. You're running for governor and lieutenant governor. And, and I think it's a sign of leadership that Pleadwell and Hermosa have not blamed somebody because, I mean, let's face it, they're not the ones who screwed that up. Someone in their campaign staff screwed that up. Someone in their campaign staff wrote Jeff Pleadwell instead of Jeffrey Pleadwell, his legal name. It's kind of like, and it's almost like a no-brainer, right? Like, why wouldn't you put the legal name? This is a legal document. This is not just a technicality. And the Guam Election Commission is doing its job. So don't blame the Guam Election Commission for this. I would have a very hard talk with whoever in the campaign screwed that up for the entire campaign. You know? Because it was something that was promising. There was a message there that would have caught on. And so where do those people go now? Because and I think that if let's face it, right? Some of these people, they're Republicans. They would have voted for Pleadwell-Hermoda. They were willing to not vote in the Republican primary and vote for Pleadwell-Hermoda because they represented more of what they believed in, right? But also, these are Republicans who look at the two Republicans running, Tony Ada and Frank Blas, and are saying, no, not for either, right? And Democrats who just look at Pleadwell and Hermosa and are like, yeah, I can get with that. Or more importantly, independents. That's because I think that's what this team really was bringing in. And there's a lot of independents on this island. There are more independents than there are Democrats and Republicans put together. And so independents who would look at the parties and be like, this is the same thing. And I think that there would have been an issue now that they're not going to be on the ballot, right? There would have been an issue of, oh, we're homeless now. We don't have a place to go. If it weren't for Terlahi and Perez running in the election, I think, and so Perez being on the ticket, if I understand Hermosa and Pleadwell voters a little bit, I would think that Perez being on the ticket would make things a little difficult for them because they just don't align with, Pleadwell and Hermosa voters are just not concerned about the environment. Let's just put it that way. They're just not going to be concerned about ensuring that the earth survives for human beings for the next 300 years. This is not one of their things, right? So there's that. But I think they identify very much with Therese Terlahi, and maybe not because they agree with everything that Therese Terlahi says or does, but they believe that she's independent and that she is honest. That's what they believed about Jeff Pleadwell and Charlie Hermosa. And so you follow the logic. They're not going to believe that about the people who've been embroiled in politics for the past several years. Joseph Augustine, Josh Isbeth. They're especially not going to vote for Josh Tenorio. Pleadwell and Hermosa voters, the one person they're not going to vote for is Josh Tenorio. Some of them might go, and I believe that they'll go and vote for Frank Blas. I don't think that they're going to vote for Tony Ada. I think that Pleadwell and Hermosa voters are like the anti-establishment. And when they look at the Republican ballot, they'll see that both are establishment candidates, but that Tony Ada is more the establishment candidate, mainly because of all the people who have endorsed him and the attachment of the Calvos to that campaign, right? So I'm just being real here. I'm not saying, this is not like me saying anything bad about these candidates. This is just me theorizing how these voters encounter these candidates that are on the ballot, right? These people are not going to vote for Joseph Augustine. They see him as a dinosaur and part of the problem. But I know that many of these people have said nice things about Therese Terlahi very publicly. And what drove them to support Pleadwell and Hermosa, and now that they need a place to go to vote, if they go and vote, I think that's the big question here, right? Can they be galvanized to go and vote in the primary election? Is they're going to look at Therese Terlahi and see a horse that they can ride on. That's something that they like. I did not mean that to sound. Let me just rephrase that. I'm so sorry. They see Therese Terlahi as a candidate that they can support. Maybe they won't be as proud to support her as they would have Jeff Pleadwell and Charlie Hermosa, but she aligns a lot more with the change that they want to see, because it all comes back to that. It's a change in leadership culture that these voters want to see, because they understand that the system is so broken, that the conversation has ventured from fixing the basics throughout the government of Guam to now fixing leadership itself in the government of Guam. That's how far down the ladder, down the rungs we have gone throughout the administration that exists right now. And I mean, we are a far cry from being where we were 8 years ago. And truly, when you look at how your life is going, how my life is going, and then when we look how society is going, I think the answer to the question, are you better off today than you were 8 years ago, is very simple to answer for most of us. For Candid News, I'm Troy Torres. Join either me or Mike Nicholas for the evening show tonight. It will be either the Troy Torres show or the reality check with Michael Nicholas. I think Mike Nicholas needs to do tonight's show, right? Like, we haven't heard from him in a while, and he's just more interesting than I am. That, and I'm tired of talking. You all have a wonderful day. God bless you.